Good morning, ladies and gentlemen, especially to our THC 122 instructor, Mr. Rolando Laurenti Jr. I am Sheilamie P. Bernal, and we are Group 3. And in this video, we are going to discuss our topic entitled Basic First Aid Procedures. With our discussion, we have intended learning outcomes. After successful completion of the course, students will understand their own abilities and limitations, stay safe and calm at all times, assess a situation quickly and calmly and summon the appropriate help if necessary, assist the casualty and provide the necessary treatment with the help of others if possible, pass on relevant information to emergency services or to the person who takes responsibility for the casualty, and lastly, be aware of your own needs. Foremost, I would like to introduce to you first what is first aid. First aid is the initial assistance or treatment given to a person who is injured or suddenly becomes ill. The person who provides this help may be the first aider, a first responder, a policeman or fireman, or a paramedic or emergency medical technician or AMT. This chapter prepares you for being a first aider psychologically and emotionally, as well as giving practical advice on what you should and should not do in an emergency situation. Preliminary questions or diagnosis. What are the components of fire? According to Read Zone 2016, there are 3 components needed to start a fire: a fuel, oxygen, and heat. This is commonly referred to as a fire triangle. If any of the components is missing, a fire cannot occur. A fire triangle is a simple way of understanding the 3 elements a fire needs to ignite. Each side of the triangle represents one of the 3 ingredients: oxygen, heat, and fuel, demonstrating the interdependence of these ingredients in creating and sustaining fire. A fire naturally occurs when the elements are present and combined in the right mixture, meaning that fire is actually an event rather than a thing. When there is not enough heat generated to sustain the process, then the fuel is exhausted, removed, or isolated, or when the oxygen supply is limited, then a side of the triangle is broken and the fire will die. In recent years, fire experts have redefined triangle to tetrahedron, adding an actual chemical chain reaction component to the 3 already present in the fire triangle. Basically, when the 3 classic components are still needed, an actual chemical reaction must take place in order for the fire to ignite. Once a fire has started, the resulting exothermic chain reaction sustains the fire and allows it to contribute until at least one of the elements of the fire is blocked. As with the fire triangle, as soon as one of the 4 elements of the trihedron is removed, combustion stops and the fire is extinguished. Okay, before we proceed, here's our short demonstration on how to use a fire extinguisher.
Good day everyone, I am Rachel Kate Antolihao from BSH 1C. So today, I will demonstrate how to use the fire extinguisher. First, hold the pin. This will break the timber seal. Second is aim. Aim the low pointing the nozzle of hose at the base of the fire. Do not touch the horn on the CEO extinguisher, gets very cold and can damage the skin. Third is squeeze. Squeeze the handle, release the extinguishing agent. Fourth is the squeeze from the side to side at the base of the fire, the fuel source, until the fire is out.
Okay, let's proceed. First aid priorities. Assess a situation quickly and calmly. First, protect yourself and any casualties from danger. Never put yourself at risk. Watch out for danger. Your first aim is to avoid anyone else being put at risk. For example, from oncoming traffic in a motor vehicle collision, make sure it is safe to approach the scene. Never put yourself at risk. It is if no one helped, you become a second victim. Second, Prevent cross-contamination between yourself and the casualty as best as possible. Before administering first aid, you must wash your hands, use latex, vinyl or disposable gloves, use plastic apron, use safety glasses to protect the eyes, and lastly, use a resuscitation mask if available. During the first aid treatment, wear gloves that are not thin, worn or torn. Wear 2 pairs of gloves if possible. Do not cough or sneeze onto the casualty's wounds. Use clean bandages and dressings. Clean wounds and try not to get dirt into them. Wash off any body fluids immediately. If you are accidentally cut and there is a blood from the casualty near or in your cut, wash the cut immediately with running water, cover the wound, and seek medical advice. After administering first aid treatment, dispose of gloves, blood-soaked bandages, and pads properly. Wash face masks and any contaminated equipment in bleach. Soak them in the bleach solution for a minimum of 30 minutes. Wash hands thoroughly. And lastly, wash bloods off any clothes or surfaces with bleach. And always remember the contamination of body fluids. Eyes and mouth. Wash thoroughly with cold running water and seek medical advice immediately. Hands. Wash thoroughly with soap and running tap water. Wounds wash with antiseptic, cover, and seek medical advice immediately. Then next, comfort and reassure casualties. Stay calm and take charge of the situation. Introduce yourself to them and help gain their trust. And third, explain the situation and anything you're going to do before you do it. And lastly, treat the casualty with dignity and respect at all times. Then after that, assess the casualty. Identify as best as you can the injury or nature of illnesses affecting a casualty. If there's more than one casualty, make sure you help those with life-threatening conditions first. Use the primary survey to deal with any life-threatening conditions. When these have been dealt with, successfully move on to the secondary survey. And then second to the last, give early treatment and treat the casualties with the most serious life-threatening conditions first. If a person is unconscious but breathing and has no other injuries that would stop them from being moved, place them in a recovery position until help arrives. Second, keep them under observation to ensure they continue to breathe normally and don't obstruct their airway. Then what if someone is unconscious and not breathing? If someone isn't breathing normally after an incident, call an ambulance and start CPR straight away. Use hands-only CPR if you aren't trained to perform rescue breath. And lastly, arrange for appropriate help. Call 911 emergency help if you suspect serious injury or illness. Take or send the casualty to the hospital. Transfer him into the care or a healthcare professional or to a higher level of medical care. Stay with the casualty until care is available.
How to prepare yourself. When responding to an emergency, you should recognize the emotional and physical needs of all involved, including your own. You should look after your own psychological health and be able to recognize stress if it develops. A calm, considerate response from you that engenders trust and respect from those around you is fundamental to your being able to give or receive information from a casualty. This includes being aware of and managing your reactions so that you can focus on the casualty and make an assessment. By talking to a casualty in a kind, considerate, gentle, but firm manner, you will inspire confidence in your actions and this will generate trust between you and the casualty. So, be prepared to assess the situation, use common sense and whatever you have on hand to take care of yourself and your loved ones. Without this confidence, he may not tell you about an important event, injury, or symptom and may remain in a highly distressed state. The action described in this chapter aim to help you facilitate this trust, minimize distress, and provide support to promote the casualty's ability to cope and recover. So here are the key steps to being an effective first aider. First is be calm in your approach. Second is be aware of risk to yourself and others. Third is build and maintain trust from the casualty and the bystanders. Fourth is give early treatment, treating the most serious conditions first. Fifth is call appropriate help. And the last one, remember your own needs.
In any emergency, it is important that you follow a clear plan of action. This will enable you to prioritize the demands that may be made upon you and help you decide on your best response. So next, the principal steps are to assess the situation, to make areas safe if possible, and to give first aid. So first, let's talk about assess the situation. Assess the situation is you need to check if there is any potential dangers to yourself, to any bystanders, and especially to the patient. Next is to make the area safe if possible. In this area, you need to evaluate or observe around the surroundings if there is a potential danger occurring. And lastly is to give first aid. You need to give first aid to life-threatening emergencies and injuries based on initial assessment. Next, use the primary survey to identify the most seriously injured casualties and treat them in order of priority. Having the primary survey is you can determine persons on emergency situation. Then you can list the persons as one of the priority to be aided or given response. Evaluating the scene accurately is one of the most important factors in managing an incident. You should stay calm, state that you have first aid training, and if there are no medical personnel in attendance, calmly take charge. Identify any safety risk and assess the resources available. So these factors will help you manage the incident according to a basic manner of giving first aid. Just remember, do things step by step to give an accurate first aid. Action for key dangers you may face, such as fire, are dealt with in this chapter, but be aware too of tripping hazards, sharp objects, chemical spills, and falling debris. All incidents should be managed in a similar manner. So, there are factors considered in an incident. So first, we have safety. So here are the questions that talks about safety. What are the dangers and do they still exist? Are you wearing protective equipment? Or is it safe for you to approach? So next, we have scene. So the questions that lies in scene is, what factors are involved at the incident? What are the mechanisms of the injuries? How many casualties are? What are the potential injuries? So lastly, the situation. The situation will ask this: what happened? How many people are involved and what ages are they? Are any of them children or elderly? So safety. To secure safety of life is you need to give first aid as a response. Next, scene. So the scene is mainly the incident that had happened or that has occurred. So lastly, the situation. In this area, you can know what actually had happened in an incident. So next, we're gonna tackle about the ABC check. So the ABC stands for airway, breathing, and circulation. So the ABC check is a first aid.
The ABC check. Airway. Is the casualty's airway open and clear? If no, in conscious state, if the casualty is conscious, treat conditions such as choking or suffocation that cause the airway to be blocked. Go to the next stage, breathing, when the airway is open and clear. And if unconscious, if the casualty is unconscious, tilt the head and lift the chin to open the airway. Go to the next stage, breathing, when the airway is open and clear. Is the casualty's airway open and clear? If yes, go to the next, breathing. Breathing. Is the casualty breathing normally? Look, listen, and feel for breath. If no, in unconscious state,
Treat any difficulty found, for example, asthma. Go to the next stage, circulation, when the casualty is breathing and the problem is being adequately treated. If no, in unconscious state, if the casualty is unconscious and not breathing, call for emergency help. Bring CPR. If this happens, you are unlikely to move on to the next stage. If yes, go to the next stage, circulation. Circulation. Are there any signs of severe bleeding? If yes, control the bleeding. Call for emergency help. Treat the casualty to minimize the risk of shock. If no, if life-threatening conditions are managed or there are none present, move on to the secondary survey to check for other injury or illness.
So, good day, sir. By the way, I am Jaica Diot from BSHM1C, and in this video, I am going to report my topic about first aid in the injured. What is trauma? The word trauma is used to describe an injury to living tissue caused by an extrinsic agent. An injury is defined as damage or harm caused to the structure or function of the body by an outside agent or force, which may be physical, chemical, or even psychological. Incidence of injuries. In developed countries, every year, a serious trauma experiences about 3% of the total population. Trauma affects significantly more males, more than 60%. Of the total number of injured, 4% of them being permanently disabled and 1.5% die. It is important to note that death and disability due to trauma affecting mostly young adult segment of the population, people ages 1 to 45. The injuries are a major source of healthcare costs. An annual price of providing for injured gets to an amount which is almost a double price of providing cardiovascular and malignant disease together.
Good day everyone, especially to you Mr. Rolando Larante Jr. I am married Charisse Dalan. I am from Group 2. So, my topic for today is all about causes of injuries and how they are divided by cause. What is injury? Any damage of your body can be called injury. Injuries can be caused by an accident or act of violence and may occur at home, work, or play. They can be due to impact from blunt objects or objects that penetrate the body. So we have already the idea what is injury, and injury can happen anytime and anywhere. It's either in your home or at the workplace. Next is causes of injury. Injuries can be accidental or intentional, as in the case of act of violence, and can be caused by blunt or sharp objects. Impact at high speed, force, animals or insect bites, fire or extreme heat, and exposure to chemicals and toxins. You can prevent or reduce the risk of many injuries by following the basic safety precautions. Like for example, just like in the hotel industry, one of the most important factors that they must be considered is the safety of the guests as well as those employees. So next is, there are numerous causes of injury. First is act of violence by others, like physical violence, sexual violence, psychological violence, emotional violence. So those are one of the examples of act of violence. Next is bicycle or motor vehicles accidents. Some common examples or causes of bicycle or vehicles accidents is overspeeding, impaired driving, overtaking. So next is bite or sting injuries. The difference between bite or sting injuries is that bite when insects process in the skin, while sting is when the animals or transfer the toxic venom into the body's skin. But the similarities between them is that they can harm the body or they can damage our body. So the effects of bite or sting injuries is dizziness or trouble of breathing or swallowing. Next is burns or thermal, chemical, or electrical. So burns are characterized by severe skin damage that causes the affected skin cells to die. Also, most people can recover burns without it have serious consequences depending on the cause and the degree of the injury, like the 7th degree, or 1st degree, 2nd degree, and 3rd degree. Next is drowning. Drowning occurs when submersion in liquid causes suffocation or interferes with breathing. During drowning, the body is deprived of oxygen, which can damage the organs, particularly the brain. Next is falls and cracks. Falls can cause broken bones like wrist, arms, hip fractures, and ankles. Also, falls can cause head injuries. So next is overuse and repetitive motion injuries. So repetitive motion injuries also called repetitive stress injuries. So these injuries usually develop over time and can cause pain, tingling, numbness, and weakness. Next is poisonings and chemical exposures. And lastly is sports or athletic injuries. So the common types of sports or athletic injuries is sprain, dislocation, fracture, swollen muscle, knee injuries. So those are all the common types of sports or athletic injuries. So that's all about the topic, which is the causes of injuries and how they are divided by cause.
Hello everyone, I am Dangel from BSHM1C, and my report is all about the parts of the body, symptoms and signs of injury. What are the symptoms and signs of injury? Injury symptoms and signs vary depending on the parts of the body involved and the type and severity of the injury itself. If you can identify the cause of the injury, you can begin to remedy the situation. Don't let the problem continue or worsen. The parts of the body, symptoms and signs of injury. In the head part, head injuries are one of the most common causes of disability and death in adults. A head injury is a broad term that describes a vast array or injuries that occur to the skull, brain, and underlying tissue and blood vessels in the head. Bleeding, fractures, bruising occur with skull fractures or other blood clots such as a subdural or epidural hematoma. Next, swelling. Cerebral edema is also known as brain swelling. It's a life-threatening condition that causes fluid to develop in the brain. Tenderness or pain. Cerebral spinal fluid from ears. Cerebral spinal fluid or CSF is a condition in which spinal fluid drains from ear. There is a bone called the tegmen that separates the ear from the brain. In the neck, bleeding, fractures, bruising, swelling, deformity, tenderness or pain, numbness or tingling. Numbness in your neck might feel like your neck is tingling or like it's asleep. Shoulders and chest, bruising, swelling, gently, tenderness or pain when gently spring the ribs, unequal rise of the chest with each breath. Abdomen and pelvis. Rigidity. One of the most common abdominal causes of rigidity is appendicitis. Tenderness or pain, swelling. Arms and legs, bleeding, fractures, soft tissue injuries, tenderness or pain, loss of strength. Back and spine, bleeding, deformity, tenderness or pain, inability to move a body part. In some cases, injury can be life-threatening. Life-threatening symptoms-related injuries are bleeding or abdominal trauma while pregnant, bluish coloration of the lips or fingernails, change in level of consciousness or alertness, chest pain, chest tightness, chest pressure, palpitations, inability to move a body part, or breathing problems such as shortness of breath, difficulty breathing, labored breathing, wheezing, not breathing, choking, severe pain, trauma such as burns, significant injuries to the head, neck, or back, uncontrolled or heavy bleeding, hemorrhage, vomiting blood, major rectal bleeding or bloody stool, and then last, weak or absent pulse. Treatment of injury depends upon the type and severity. In the event of a severe injury, calling all and use of basic life support measures can save a life. It is important to prevent any further injury, which may involve stabilization of the spine, splinting injuries, and reducing ongoing blood loss as much as possible. Injury can be life-threatening. Seek immediate medical care if you or someone you are with have any of these life-threatening symptoms. That's all, thank you.
Good day, Mr. Laurente. I am Rochelle Balaod Horomo and this is my report. First aid in the injured. First aid in the injured is generally consists of a series of simple and in some cases potentially life-saving procedures that an individual can be trained to perform with minimal equipment. It is usually performed by non-experts or sometimes by an expert in case of an emergency, but trained personnel to an injured person until definitive medical treatment can be accessed or assessed. Certain self-limiting illness or minor injuries may not require further medical care past the first aid interventions, but in other cases, first aid is only the first step in the treatment of injured persons.
Good day everyone, my name is Ann Montecalvo. So I'm going to report about first aid for wounds. A wound is any type of injury to the skin. In general, wounds can be classified as closed, where the skin stays intact, or open. In open wounds, the skin is cracked open, leaving the underlying tissue exposed to the outside environment, which make it more vulnerable to bleeding and infections. In closed wounds, the skin is intact and the underlying tissue is not directly exposed to the outside world. Even with the skin intact, the damage can reach down to the underlying muscle, internal organs, and bones. That is why this kind of wounds can be complicated by severe bleeding, large bruises, nerve damage, bone fractures, and internal organ damage. Open wounds can be classified according to the object that caused the wounds. So naay 7 types of open wounds: incisions or incised wounds, lacerations, abrasions, avulsions, puncture wounds, penetrating wounds, and gunshot wounds. So incisions or incised wounds caused by a clean, sharp-edged object such as a knife, razor, glass splinter. Lacerations, irregular tear-like wounds caused by some blunt trauma. Abrasions, superficial wounds in which the topmost layer of the skin, the epidermis, is scraped off. Abrasions are often caused by sliding fall into a rough surface. Avulsions, injuries in which a body structure is forcibly detached from each normal point or insertion. Puncture wounds, caused by an object puncturing the skin such as a splinter, nail, or needle. Penetrating wounds, caused by an object such as a knife entering and coming out from the skin. Last is gunshot wounds, caused by a bullet or similar projectile driving into or through the body. There may be 2 wounds, one at the site of entry and one at the side of exit, generally referred to as a through and through.
That will be all. Thank you so much for watching and listening, and have a nice day.